Okay, purpose of our meeting this evening is to reinforce the rules of a proper surgical scrub. As a part of a teaching hospital, we are all responsible for guiding our students in proper aseptic technique prior to entering surgical suites for the sake of our patients, for the safety of our patients. According to AST.org, when completed properly, the surgical scrub reduces resident microbial population to a minimum and therefore reduces the risk of SSI for our patients. So you're going to begin with the pre-wash. Wash the hands and forearms with soap and water. Check to make sure that the skin is intact and always keep your hands above your elbows. For the surgical scrub, I also referenced AST.org. You're going to begin by using the disposable nail cleaner. Clean underneath each nail. Then with your scrub brush, you're going to start at your fingertips. Scrub all 4 planes of the hand, all 4 planes of each finger, and include the web skin in between the fingers. Continue up the arm in sections, each with 4 planes, and you end 2 inches above the elbow. You may continue to the other arm. Never return to an area that's already been surgically cleaned, and if at any point you touch a non-sterile item, you must start the scrub over. Now, there are 2 accepted methods that are widely used. First is the time method, and according to Medscape.com, that should last no longer than 5 minutes and does not include the pre-wash or the rinse. The second time, which is less commonly known about, is the brushstroke method, and information gathered at brooksidepress.org says that this should begin at the fingernails for 30 strokes. Each plane of the hand is 20 strokes. Each plane of the fingers are 20 strokes. You continue up the arm in 3-inch sections, 20 strokes for each section. The rinse begins at the fingertips and continues up the arm and out of the water source. It is not acceptable for the arm to go back under the water source in the reverse motion. It is very common to touch a non-sterile item while rinsing. If so, you must start the scrub over. Upon completion of the sterile scrub, be careful not to drip onto the sterile field as you grab a sterile towel from the folded corner. Allow the towel to fall open. It doesn't want to fall open. Begin at the fingertips and in a circular dabbing motion, move up the arm. In order to proceed to the other side, you must use the dry, unused portion of the towel. Now, it's imperative not to let the towel touch your scrubs in any way. The best method I have seen is to lean slightly forward with your chest out, with your rear kind of sticking out a little bit. When you're finished, you can toss the towel into the trash. Sterile technique in regards to the surgical scrub is highly important to our patients' safety. As a teaching hospital, we have tech students, nursing students, medical students, and residents on a daily basis. Realistically, we help train surgeons here. The successful completion of the surgical scrub means the difference of a medical student watching from across the room or having the enrichment of being able to be directly at the sterile field. The information they acquire here will be taken to the many areas they eventually decide to call home. It is our responsibility to recognize the proper rules of the surgical scrub in order to protect our patients and to teach our students. Now, I've blatantly referenced AST.org, Medscape.com, and BrooksidePress.org. Each of these sites have much of the same information that they share in reference to the surgical scrub. So feel free to reference any of these sites if you ever need to brush up on your skills. Thank you for your time.